And that's where Parker's going to share some of his customer success expertise.
Yeah, so I think it's good to set the stage a little bit in terms of just coming up with a common definition around what a health score does. So really what we're looking to do is make sure that we're getting early warning indicators for a customer's likelihood to either renew or churn. What we don't want to do is pull together data and metrics on things that we already know. Oftentimes I see customers go or companies go in the wrong direction when it comes to trying to just report on things that they have an awareness of. It's interesting, it's not really actionable. So what we really want to try to do is get ahead of that. We're looking for preceding signals, so leading behaviors. We don't want to report on the lagging indicators that we already have seen transpire. We want to get ahead of those. So we're looking to drive further, if you think about sort of upstream signals, we're looking to drive further upstream. We're looking to drive actions that will help us prevent those problems from occurring. And it's really going to help to serve as really like this direction for us in terms of how do we want to mobilize our resources? How do we want to implement our strategies, our playbooks? How do we make sure that we are leveraging this predictive scoring so that we can bring our resources to bear on those customers that are the most likely to potentially go in a negative direction or potentially churn? So what I've used in the past, if you could advance one slide, please, Heather, is a framework that I put together. It's called Signal. A little clever, I guess. But the idea here is there are several different components when we start to think about how to build out a health score. As I said, I've worked with several different health scores across numerous different companies, and I see that oftentimes the health scores either they're not trusted or they don't get you to a place where they're really driving that value of what they're intended to be. So I'm just going to go through this briefly as we think about the foundational pieces that then we can then leverage as we build these out in HubSpot. So starting at the top, so start small. When you're thinking about a health score, we're looking at 3 to 5 signals. We're not looking to build out a whole repertoire of 10 signals that are coming in. We really want to focus on utility before we start adding complexity. So especially if you're starting from scratch, look at what you have access to. Are those data points reliable? Are they available across all customers? Can we correlate those signals with ultimate health? So what happens, early in the process, and then what happens after that? Then we're starting to look at identifying behaviors. So what are some examples of good? Look across your customer base, try to figure out who are your best customers, and then try to replicate the things that they are doing across your other customers. Look for the signals that drive that. So we're trying to find those preceding behaviors that lead to the outcomes. What do those customers do consistently? Or perhaps, what is the consistent feedback that we're getting from our customers that have churned or are likely at risk? So those will start to help to map out really what those signals are and which ones we want to focus on. Next, and we're going to talk about this a lot throughout this conversation, but data is essential. We've got to make sure that we've got clean data. This is where it comes together in HubSpot. So ultimately, what we're looking to do and what HubSpot is trying to enable us to do is to leverage the data that's ultimately native in HubSpot so that we can then take that data and then operationalize it very simply. We can do this today without, these capabilities. A lot of our tools are, disparate solutions. They're spread out across the organization. Data's kind of spread out. HubSpot is really trying to give us an opportunity to take advantage of what's natively in the CRM and then harness that and then operationalize it quickly. And there's some cool capabilities there. So where we can, we want to try to automate this. If you're gathering data, make sure there's a corresponding field in HubSpot, and then ultimately you can take those fields and you can convert them into signals for your health score. Once you feel like you've got, those 3 to 5 metrics, you've got that basic understanding in terms of how you want to build your health score, then we're looking to really normalize the data. So we're going to start to do a little bit of experimentation here. So I often see companies rush through this. This is where, we have some hypotheses that we want to play out, but we also need to kind of allow the health score to, I'd say, marinate a little bit and make sure that the signals are actually what we hope that they are going to give us insights into. So you'll want to make some adjustments on this. You're going to learn some things as you go. For example, maybe your first pass is going to give you way too many, red customers, if you will. There's an opportunity then to tweak it. So what I'd recommend here is do this a little bit behind the scenes. Don't be too quick to roll this out to your teams. because what you want to do is make sure that when you do roll it out to the teams, you're doing it in a very trustworthy way. They want to be able to count on the information that they're receiving. And so if you can do some of that dirty work behind the scenes, you're going to really get the team bought in, which leads us to activate. Health score is great for gathering information, but if it's not actionable, you really dilute the value of a health score. So what we're trying to do is make sure that we can then take the health score and again, those predictive indicators and convert them into calls to action, convert them into tasks for your team so that you can really automate the mobilization of your team to bring their skills to bear so that you can get ahead of some of those risk factors. So I would recommend here, you want to keep your signals and your alerts to a minimum as best you can to start. So don't flood the team with a whole bunch of alerts to say, go look at this, go look at this. It's going to cause some probably resistance to adoption. But again, if you're keeping with starting small, keeping things simple to start, you can always build from there as the team gains a little bit more trust. The great thing here, and this is where I think HubSpot is really trying to empower us, is these actions can be deployed to either a human, a CSM, a support agent, an account manager on your team, or they can be deployed to an AI workflow agent. So we'll talk a little bit about the agents that HubSpot's now bringing to market, but you can automate these. You can make sure, depending on the signal, that you've got the right sort of deployment in terms of how you're going to operationalize that. And then lastly, I'd just say health scores are really never done. Your business is changing, your customers' needs are changing, your product's evolving. So you're going to want to review these periodically. So once you've gone through the first pass, it's out in the field. Make sure that you're learning from that. You're coming back to what are some of the themes that are emerging from those health scores. It'll allow you to dive deeper on some of those areas and maybe make some tweaks along the way. One caution here I would say is just note that every time you change the kind of the fundamentals of a health score, you're gonna upset your trending. So that might be something that you want to do maybe a couple times a year or once a quarter or something along those lines, but don't do it too frequently or you really will lose some of the value that you're going to see in terms of how customers are trending over time.